When I think about which supplements are best for helping patients with joint pain, the ones that typically come to mind are turmeric, glucosamine and chondroitin sulfate, and collagen. And all three of those groups have some evidence supporting their use in reduction of pain associated with osteoarthritis and other joint conditions. In With respect to which of these are better or which of these have more evidence between, say, turmeric and glucosamine, in my understanding of the literature, glucosamine and by itself actually does not have a large effect on joint pain, and in fact, it has been compared to placebo in a number of studies without a significant difference between the two. When you combine chondroitin sulfate with glucosamine, then we start to see some benefits. And there's even some evidence showing that there's some joint preservation radiographically that can be seen in patients who are on glucosamine and chondroitin sulfate long term. However, when it comes to pain in particular, the evidence seems to support turmeric as a better supplement for joint pain. There are more studies showing that it's helpful, and a number of studies have shown equivalent benefits for pain associated with knee osteoarthritis between turmeric and a standard non-steroidal anti-inflammatory like naproxen. With respect to collagen as a supplement for joint pain, most patients who are going to benefit from collagen are going to start to see some benefits typically around 12 weeks. It can take longer, but most of the evidence suggests that it takes a little bit of time for significant benefit with collagen. Although there are some studies showing that the effects of collagen in reducing pain associated with exercise, particularly related to knee pain, can happen faster, and you may see results as early as 4 to 6 weeks with that. So when I think about what things are worth taking for joint pain, it obviously depends on the severity of the joint pain and how the patient feels about using medications that are not supplements like anti-inflammatories. But the two supplements that I would generally recommend that I think have the strongest evidence are collagen and turmeric. And there is a cost associated with all of these, but the good thing is all of these medications, supplements tend to be very well tolerated with a very safe risk profile. And there is a growing body of evidence showing that collagen and turmeric are beneficial and show statistically significant improvement with respect to pain as compared to placebo. So I'm often asked by patients which supplements are best for joint pain. And in general, the supplements that I recommend include glucosamine with chondroitin sulfate, turmeric, and collagen peptides. In terms of the literature and my understanding of the literature up to this point for all of these different supplements, turmeric and collagen seem to have a stronger body of evidence supporting their efficacy. When I'm thinking about turmeric versus glucosamine, glucosamine by itself has not been shown to have a significant benefit on joint pain or joint protection. There are, however, some studies showing improvements in pain and improvements in the radiographs after long-term treatment with glucosamine combined with chondroitin sulfate. So when I recommend that to patients, I do recommend they get the combination supplement. That being said, in the literature, there is a stronger body of evidence supporting the use of turmeric for joint pain, including several studies comparing it with non-steroidal anti-inflammatories showing comparable levels of pain reduction between those two treatment arms. In terms of collagen peptides, collagen most of the time will take about 12 weeks to work, and some patients it can take as long as 6 months. But there is some evidence that collagen, particularly in its use for reduction of exercise-associated joint pain, may work faster in the 4 to 6 week time frame, and there is strong evidence supporting its use for exercise-associated joint pain. I'm often asked by patients as well, is collagen or any of these other supplements, are they worth taking for joint health? We don't have long-term evidence showing that these supplements really protect the joint and reduce the progression of osteoarthritis, but the short-term evidence is somewhat favorable with respect to collagen. And combining what we see in the short-term evidence with the evidence we do have showing that it is effective in reducing joint pain, separate from joint health, I do think it's reasonable for patients to take collagen. And I think as long as the cost is not prohibitive, I think collagen probably is worth it for joint health in patients with mild to moderate degenerative joint disease. Each patient is unique, however, and different patients will respond to different supplements differently. And so whenever I am making any of these recommendations to patients, I do generally suggest that they consult with their primary care provider to ensure there's no medication interactions or any other health concerns associated with them.